Next, we're going to go ahead and assess the neurological system. We'll test, of course, the cranial nerves. We can test the olfactory nerves, and that's just his sense of smell. Can the patient smell? Here, I've got some carpet freshener, and I'll ask him to sniff it, and he can tell me if he can smell it or not. So he can smell this air freshener. I'll also ask him to smell. And he knows the smell of the lotion. So it's safe to say that his olfactory nerve is intact. We'll test the optic nerves. I'll ask him to cover one eye. And I'll ask him to move in the direction of the light. So it's safe to say that when he looked up, out to the side, and down, the eye movement was normal. And of course, we will repeat that test on both sides, and that's checking for visual acuity. It's safe to say that his optic nerve, of course, is intact. We'll ask him to raise his eyelids. And then at this time, I'll also look for pupil constriction and looking for his lens to change shape. And the pupils did constrict. So it's safe to say his oculomotor nerve is intact. Then I'll ask him to look up and look down, up and down. Up and down eye movement shows me that the trochlear nerve is intact. And then I'll ask him to open and bite and clench and chew. And that test is showing me that his trigeminal nerve is intact. Of course, that nerve is responsible for the jaw opening and closing, mastication, clenching, and biting. Then we'll look at the abductions, and this is just for lateral eye movement. So I'll ask him to move his eye side to side, and we can see that that his abductions nerve is intact as well. And then facial, I'll ask him to close his eyes, make facial expression. I'll ask him to say B, M, V, and the rounded vowels like O and things like that. That shows me that his facial nerve is intact. Then we'll look at the acoustic nerve, and that's just hearing in equilibrium. As well, when we did the Rhine test, we actually used the tuning fork. And when we did the Rhine test on this patient, of course, it was within normal limits. So it's safe to say that his acoustic nerve is within normal limits as well. And then we've got the glossopharyngeal. I'll ask him to swallow, and just when he talks, and that lets me know that that is intact as well. And then we'll look at his vagus. We want to see if he has a gag reflex. So I'll ask him to open his mouth. Open your mouth wide. Stick your tongue out. And he does have a gag reflex. So we can say that his vagus nerve, of course, is within normal limits as well. And then we look at the spinal accessory nerve. I'll ask him to turn his head. And I'll ask him to shrug his shoulders. And it's safe to say, you don't have to keep your head turned, that his spinal accessory muscle is intact. And then we'll look at the hypoglossal. And for this, I'll ask him to say L, F, D, N, and I'll ask him to swallow. And he's not having difficulty, so it's safe to say that his 12 cranial nerves are intact. And once we do this, we want to check the cerebellar function and the proprioception. So we'll do the rapid rhythmic alternating movements. So with that being said, we're going to ask him to put his hands on his knees, both hands. And I want him to flip his palms up and down. And he's doing it simultaneously and symmetrically on both sides. So it's safe to say that his rhythmic alternating movements are within normal limits. We also want to check for the accuracy of the upper and lower extremity movements. We want to, at this case, I'll ask him to put his finger to his nose, and then to my finger. Nose, your nose, to my finger. And that was intact. He accurately did it. And then, of course, we'll we'll do the Romberg test to test his balance. So I'll ask the patient to stand up with his feet together and his arm at his side. And I'll ask him to close his eyes. And he's pretty much able to stand there with his eyes closed and maintain his balance. And of course, I'd ask him to open his eyes and do the same thing. And then I want to assess his gait. So I'll ask the patient to walk. And it seems that his gait, is within normal limits. We'll also assess, you can have a seat, sir. We'll assess for superficial touch, and that's, I'll touch the skin and he'll tell me when I'm touching.
Right.
You feel it?
Mm-hmm.
Okay.
All right.
Now, we're also going to check for superficial pain. So what I'll do is, with a piece of the tongue depressor, a sharp side of it, I'll just press to see if he can feel the pain.
Mm-hmm. Mm-hmm.
So, it's safe to say that he has pain sensation, which is a good thing. And then, of course, we'll take the tuning fork and we'll use the tuning fork over all of the bony prominences on his upper extremities and his lower extremities. And of course, I will repeat using the tuning fork on his lower extremities as well. And then we want to check the position of the joints. And so with this, I'll use his great toe. And I'll hold it to the side and I'll ask him to which direction that I'm moving his toe.
Right. Left. Up. Down.
So we've checked for the position of his joints, and it seems like his joints are okay. Next, I'll hand the patient a familiar object, and he will tell me what that object is.
Knob.
And that is correct. That is a knob. So with that being said, it is safe to say that sterogenesis is within normal limits. And then we'll do the 2-point discrimination. And with the 2-point discrimination, you take an object that has 2 points, and for this purpose, I'll use the tuning fork. And he should feel when I touch him. He should feel both points. How many?
1, 2, 2, 1, 1, 2, 2.
And then we also check the extension phenomena. So we'll touch his arms with sharp objects, and they I'll touch 2 areas, of the body with a sharp object, and they should feel the same.
2.
Did it feel the same?
Mm-hmm.
Okay. Next, I will ask him to identify the letter that I'm drawing in his hand.
H.
That was correct. I drew an H in his hand. That's graphesthesia. And then I'll also ask him where I'm touching when I touch areas on his skin.
Arm. Ear. Hand. Arm.
So he is able, of course, to determine when I'm touching him. So we know that the point location, of course, is okay. Then I'll ask this patient, I've got to check his abdominal reflexes. I'm going to position my patient in the bed and ask him to lay in a supine position, which is on his back. And then I'll take the reflex hammer, and I'll use the reflex hammer. And what I'll do is I'll stroke each quadrant with the reflex abdomen. I'll do the lower quadrants. I'll do it downward away from the umbilicus, and then I'll do the upper quadrants upward away from the umbilicus. and it's safe to say that his abdominal reflexes were in tight. And then I'm going to look at his cremasteric, and that's when I'm stroking the inner thigh. And when I stroke the inner thigh, then the testicles and scrotum should rise. We'll also do plantar, and that's when I'm the bottom of his feet. You feel it? Mm-hmm. Okay. And so we know that of course, is okay as well. And then let's do the biceps. I'll hold him at the intercubital fossa, flexing his elbow about 45 degrees. You can sit up, sir. And it's safe to say that reflex, of course, is intact. And then I will flex his arm up with his hand pronated, and then I'll also do that right above the wrist. And I can feel the elbow, so I know that of course is intact too. And I do the triceps. This will have his arm at a 90-degree angle at the elbow, supporting the intercubital fossa, and just above the elbow, I'll strike with the reflex hammer, and of course that reflex was intact. And then we'll do his knee the same way, with his knee at 90 degrees, just below the kneecap, and of course that reflex, I could feel it. It is of course intact. And then we'll do the ankle clonus reflex. And of course that one was intact as well. So that concludes our testing of the cranial nerves and the neurological system. Along with the neuro assessment, you want to determine whether that patient's alert and oriented, has any confusion or anything like that. And of course, our patient is alert and oriented, and I didn't find any neurological deficits when I completed his assessment. This concludes the assessment of the neurologicalist.